Hi.
My name is Bipasha and today I will be performing your physical examination. So let's start by knowing you. So what's your name?
My name is Bhattacharjee.
Okay. So what's your age?
50 years old.
Okay. So what do you do?
I'm a retired army person.
Okay. So today what we are going to do is we will be testing, like we will be having a series of tests in which first one will be checking your eyes, your nose, then your ears, then your other things would be like your fingers, or that will be on a later part. But first would be all those these things like the eyes, nose, ears, then your sensation of touch, pain, etc. So I will be explaining each test as we proceed on. So just follow my instructions. So would that be fine with you?
Yes.
Okay, fine. So we'll begin the test.
Okay.
These are the various instruments used for my upcoming examination or physical examination. These are the cloves, and this is a coffee, and this is a cotton wisp. So let's proceed with the tests. For the first test, I will be using some cloves and a spoon of coffee to check the sensation or the smell, the smelling power, smelling sense. For this, what you have to do is you close your eyes. I'll be closing one of your nostrils and you have to just smell from the other one and tell me what smell do you get, okay? So let's begin. Just close your eyes first. Could you smell it?
Yes.
Now you can open your eyes. Were you able to sense both of them? Like the smell of both things? Okay. So this is a Snellen chart. This would be used to check the visual acuity of the patient. Like a patient would be standing 20 feet apart from this chart and would be asked to read the smallest letters or the smallest row of letters possible with his eye. Now what you want to do is I'll be giving you this card. You have to place it on one eye and then read on the Snellen chart whichever line or the smallest line of letters possible while you're reading, okay? So just go ahead and begin with the test. Read.
DEAPOTEC.
Okay, now just repeat it on the other eye.
DEAPOTEC.
Okay, that's fine. Thank you. Now for like checking your eyes, I'll be dimming the room light a little bit and I'll flashing light on your pupils to see how it's working or not.
Okay.
So if it's fine if I darken the room a bit. Okay. Like see in front. For this test, what you have to do is I'll be moving my finger in one particular direction and you have to follow the tip of my finger, okay? So let's begin. Okay, that's fine. Thank you. Now, next test which we will be performing is a static finger wiggle test. Like in this test, what you have to do is you have to cover your one eye and by looking straight into my eyes, I'll be wiggling the fingers on the sides.
Okay.
So whenever I wiggle a finger, you just point out the place or like which direction I wiggle my finger with your eyes closed and looking at me straight.
Okay.
You understood?
Yeah, I
okay,
understood.
fine. Let's begin. Cover your one eye. for this test, you will be clenching your teeth, and I'll be checking some muscles of your face while your teeth is clenched. Okay? Clench your teeth first. Done? Okay. Relax. Now, in the next test which we will be performing is a wisp of cotton. You have to close your eyes first, and I'll be sweeping with this cotton at some areas of your face. And you have to tell me, like, did you feel it, or where did you felt it, or something like that. So, like, whenever I touch it, I'll ask you that did you feel it or not. So you'll be like saying yes or no, whatever is the scenario. Okay. Understood?
Yes.
All right. So just close your eyes first. Okay. Did you feel it?
Yeah. Yeah.
Okay.
Yeah.
Okay. Fine. Now just open your eyes. Now the next thing which I'll be doing is, it's not dangerous, so don't worry. I'll be just putting this wisp of cotton near your cornea, or like near your eye, while you'll be looking on the other side. So let's check how's your eye, okay? So I'll just make it point here. Yeah. Just look on the other side. Yeah. Okay, fine. Done. So now for this test, what you're going to do, you have to just close your eyes tightly and like close your mouth also tightly, so that when I will push or like I will stretch your muscles, you have to resist that stretch. Okay? So let's start. You understood it well, right? Okay. Clench your mouth and your, yeah. Okay. Open your eyes. Thank you. So now we'll be testing your ears. For this, I'll be using a tuning fork. In the first test, what I'm going to do is I'll be hitting this on my leg and then putting it on the center of your forehead, and you'll just tell me that on which side, or like you hear the humming voice on your both ears equally, or one was louder, other was not. Whatever is the case, you just tell me. Okay?
Both are equal.
Okay, so like you would hear it on both sides. Yeah. Okay, fine. Now in the next test, what I will do, I'll hit it again and put it on the back of your ear, and after some point you'll stop hearing the humming voice. Okay. That point you just tell me, so I'll put it on some other place to hear it again. Okay?
अभी सुना नहीं दे रहा। हाँ, yeah.
Okay, fine. Now we'll be testing or like checking your tongue. So firstly, may I have a look of your mouth or like tongue? Just open your mouth a bit. Like stick your tongue out. Okay. Now what you have to do, you have to just say ah like that, and I'll be putting this tongue depressor, like depress your tongue, so I could see the other structures of your mouth inside. Okay.
Okay.
Okay. Okay, next test, what we are going to do is I'll be testing the strength of your shoulders. You just shrug your shoulders a bit, and I'll be putting some pressure on the shoulders to put it down, so you have to resist my pressure. Yeah. Okay? Okay. Just shrug your shoulders a bit, like this. Okay, that's fine. Now we'll be testing the strength of your facial muscles kind of bit. So I'll be putting my hand, you'll just first face a bit on the other side, and I'll be putting my hand here, and I'll be pushing it back to this normal place, but you have to resist my pressure. Fine? Okay. First, look on the other side.
My findings for the cranial nerve examination are as follows. Cranial nerve 1 or the olfactory nerve had the sensation of smell intact. The cranial nerve 2 or the optic nerve had shown proper visual acuity in the patient with normal visual fields too. The oculomotor and the optic nerve had proper pupillary reactions in the patient, like the function of the nerves are proper. The oculomotor trochlear abducens nerve, or the 2, 4 and 6 nerve, showed proper function by performing proper, like by the proper movements of the extraocular movements. The trigeminal nerve showed corneal reflexes, facial sensation and jaw movements to be appropriate. The cranial nerve 7 showed normal facial movements. The cranial nerve 8 had the hearing, or is for the hearing sensation, and it was perfect. Like there was no default in the Rene and the Weber test which was performed on the patient. The cranial nerve 9 and 10, or the glossopharyngeal and the vagus nerve, showed proper swallowing and gag reflexes. The voice and speech which was conducted, or which was counted for the trigeminal, facial, vagus and hypoglossal, had no defects in them. The shoulder and neck movements which were accountable for the spinal accessory nerve, or the nerve 11, were without any defects. And at last the hypoglossal nerve also showed proper symmetry, position and movement in the